The beauty industry, they had come up with the solution for the pimples that you need to double cleanse your face.
I think those are kind of selling gimmick. People become socioeconomically richer. So the cleanse is just a temporary thing. If you want to really cleanse, start changing your diet. So your liver is a very important organ. And majority of us, we have a very bad liver because of, again, we're not eating proper diet. And everything gets stuck in your liver. And your liver has overwork to do. It's get too busy to keep you alive rather than cleaning out the stuff which causes the pimples.
Dermatology has a question that it has been avoiding for over 2 decades. What if your acne problem is always based on an assumption, a wrong assumption, and we have been building up our whole dermat on this. Welcome to Disease-Free Living Conversations, where we uncover one hidden truth about better health with Dr. Sodhi every week on Wednesday. We understand how our body works rather than fueling our body with the medicines when the disease is diagnosed. Welcome, Dr. Sodhi. I'll directly come to the point. Acne. Take us to the start point. What is acne? How it is coming to our body and why it is coming to our body. Generally, acne is connected to puberty.
That's
they
right.
say that when you hit your teens,
exactly.
you're gonna have your acne. They're gonna be pimples all over the
That's
face.
right. So that even the primitive societies, if you look, they didn't have acne. And it's,
They
I think,
didn't have acne?
No, they didn't have acne. So it's just like we have created ourselves a disease. And the treatment which we're doing is entirely wrong. We are subsiding with antibiotic, which is a specific bacteria which works on that. And now the problem is that our population is become so much resistant to those antibiotics that's not functioning anymore. And on top of that, your gut bacteria is going to be all go for hooky. It will have all the adverse effect on your gut bacteria. So you're not only treating acne, but you're creating a lot of other diseases which you don't even know.
So pimple is an outcome. That is what you are telling right
Exactly.
now.
Exactly.
Something going on in our body,
Yep.
and pimple is just a result of that.
Exactly.
Let's start with the biology. Where did it start?
So it starts in your gut.
Gut?
Yes. And basically what has happened over the way we are eating, especially the processed food, which is standard American diet, which is we all fried food, which was a very rare thing previously. And then look at the label. I encourage everybody, read the label. The other day my wife brought salad from Costco, and organic, of course, we never buy. And then it has a dressing with it. So I'm in the habit of reading every label. And it has all the wrong oil which I don't want to use. It has the
All the
soybean oil.
artificial, yeah.
It has the gum, the guar gum, xanthan gum, all
And
those-
trans fats,
and
fats included in
Exactly.
those.
So I don't want to use that. So those are the things when you're consuming the food and your gut is becoming leaky because it causes inflammation. Now that leaky gut causes a special kind of fat which is called lipopolysaccharide, LPS. And that triggers immune reaction. There's a special receptor which is called TLR4, and this is inflammatory. Now the gut is inflamed. Its body has only 3 ways of getting rid of the stuff. You poop it out, you urinate, and you sweat. When those two are loaded, urination and poop is loaded because you're not eating enough fiber.
Enough fiber, yeah.
Now it's going to come to your skin. And now all of a sudden, now you have an acne problem. So look at even 6th grade, 7th grade kids in the school. By the 8th grade, it becomes like a crazy acne. So I see a lot of those patients who has, the face is fully covered with acne. Very, very cystic acne, very, very bad. And treatments have been given to them with limited effect. They get a little better, then they worse again. And it's not uncommon these are not fixing the problem because we are creating a wrong treatment for wrong things.
Because we are not seeing the gut. Before questioning, I was going through the research. There was a research in 2002, I remember, between the teens of Papua New Guinea and Paraguay, and same condition, and not the same conditions were there, but same food, same other habits, same age group, and results were completely different.
Again, it comes back to the gut. What is your food habits are? when you're creating a leaky gut by eating wrong food, your hormones, when it's going to come, is going to have an entirely different impact on you. So that's why there's a difference.
So the gut is the first domino that falls, and then everything rest falls
Goes down the
and
hill,
down.
down the hill from there.
You mentioned about hormones. So teenage and hormones, they are directly proportional.
That's
We
right.
all know that.
That's right.
So is acne and hormone also related?
Not really.
That's strange.
Yeah, we try to blame it, but I think we did one podcast on estrobolome where your excessive hormones get cleaned out by your gut by if you eat more fiber. So that's the answer again. Yes, if you're not eating fiber rich, and look at a typical teenage diet.
Fried, French fries,
Ve-
pizzas,
Yeah.
Coke,
So
you name it and they
exactly,
have it.
and how much vegetables they have, or even for fruit or beans. We need to eat a fiber-rich food. The beans are very fiber-rich foods. Each one cup of bean can provide you 8 to 10 grams of fiber if you eat it right. So we are not eating. How many kids are eating beans? Maybe they refried beans once in a while, but again, those are a wrong combination according to Ayurvedic medicine. We're putting too many things which are competing against each other, and it's very hard on the body to digest it. So we are lacking right there. So when you eat a lot of sugar, very common in teenager kids. Even one can of soda, 8 ounce. The kids don't drink 8 ounce, by the way. There is a 35 grams of sugar in one can of soda. So that is almost 10 teaspoons of sugar.
That's
Do you
good.
put 10 teaspoons of
No.
sugar in your coffee or your tea? But we are feeding that much sugar to our kid. Now what happens when you're eating that much sugar? There's a insulin-like growth factors which get triggered on. Now that triggers your hormones DHEA, and that is again a domino effect, and that triggers your acne to be more cystic. So you see all those kids with the cystic acne, they're eating a lot of sugar. As a young kid, I loved sugar as a young kid, but we didn't eat that much. There was not available.
And that was not processed.
Not
also,
processed
doctor.
at all.
Yeah.
So very less sugar was in our diet, and I don't remember that I have even maybe I may have 1 or 2 acne growing up, which was kind of very very different and very very strange.
Ayurvedic connection. I remember we had conversation about ama, vata, pitta, everything our body is built upon. I want to understand, is acne and this vata, pitta and ama related?
Yes, so when we talked about leaky gut, that's the Aman situation right there.
Mm.
But there is also some more inclination of inflammation when you're pitta, you're dominantly pitta. You're naturally prone to more inflammation. So these pitta people are very intelligent people, go-getter, overachiever.
That's
and
the body type.
Body type.
Hmm.
Now these people will get more acne as compared to kapha people or vata people. So vata people tends to be more dry, so the skin is dry. So the acne is also, you make a lot of sebum, a lot of oily. The people say that who has more oily skin has more acne. Okay, so pitta people are those people, and the kapha people, the skin is not as oily, but they are oily but not as bad. So they can get acne too, but not as worse as pitta people get. So if you see that subset of people who are dominantly pitta constitution will get, and they are all eating wrong food. And on top of it,
They don't know their body type. There is no
exactly.
one to educate them
Exactly.
their body type.
Exactly.
I mean, I'm sitting here getting educated that it's the body type that defines whether I get acne or not, and people think it's vice versa.
I will not say that body type will, but it is the inclination.
Inclination.
They have a weakness. So everyone is different. We have some positive and negative, some strengths and weaknesses.
I mean, our bodies are prone to different things.
This is, yeah.
They are. People now get this cleansing. They say that the beauty industry, they had come up with the solution for the pimples, that you need to double cleanse your face. You need to wash your face. Is there even a reality? I
So-
see a smile on your face.
Yeah, I think those are kind of selling gimmick. People become socioeconomically richer. People can afford, and usually in just few weeks, these girls they get full of those acnes because now you close the pores and you're done. So the cleanse is just a temporary thing. If you want to really cleanse, start changing your diet. That is the basis. Our gut biome is millions and millions of years old, and it's used to certain type of food. And come this stage now, we have completely changed our diet. there is a very less fiber in our diet, there is a lesser of protein. And if we're eating protein, the protein is loaded with antibiotic, plastics, pesticide, insecticide, like the standard meat, our farm-raised fish, not the same. That's why we tell my patient organic, farm-raised chicken or pasture-raised
Yeah.
or wild-caught fish. But those are different. The composition is different. So when you're eating the food which has all these chemicals in it, your body is going to react.
And pimple is the result of that.
Result.
Sir, does pimple or the acne on our face has a pattern that can be matched? For example, if pimple is on the nose, chin, jaw, forehead, is it communicating something? Is there a pattern?
Yes. So like the acne on around your jawline is usually your adrenal glands and your liver. So that means it's a more hormonal impact. So these people are not flushing their hormones, and again goes back to not eating fiber. And the liver, most of us, it's very sad. 90% population out there has a fatty liver these days. 90%.
And liver and pimples are directly related?
Related.
That's
So you're not flushing. The main job of liver is the flushing. And when they are not flushing the toxins, you are going to throw it on the skin. So your liver is a very important organ. And majority of us, we have a very bad liver because of, again, we're not eating proper diet. And everything gets stuck in your liver. And your liver has overwork to do. It's get too busy to keep you alive rather than cleaning out the stuff which causes the pimples. So it's making you live, but not perfectly.
That's surprising. I mean, a location face mapping. Ayurveda has done that face mapping.
Exactly. In Chinese
years
medicine too.
ago.
Yeah, it's like a different portion of your face will have a different places where it is coming from. Like in very common, females before their periods, they get acne. Again, because the progesterone drops. If you have a progesterone, it should be in the last phase of the cycle, the progesterone should go higher. And that is very helpful in cleaning out the lining of the uterus, but also the hormones. But if you're not having enough progesterone at that stage, you will have more acne too. So, because they will get estrogen dominance, and and there is a lack of progesterone, so it is not matching. So the Mother Nature has created all the balances.
Yes, sir. I mean, I'm amazed how our scientists 5,000 years back, they have figured out these things so correctly, and it's still relatable.
Exactly.
Science is
So
proving it.
true.
Yeah.
So true. Yeah. So again, the things come back to the same thing. Gut biome, liver, what you putting, sugar. An average American is using several hundred pounds of sugar a year.
Sir, I want to understand the herbs. There are generally, I mean, the little I know is Neem is the perfect
From
remedy.
your great-great-grandmom's
Yeah, the
side,
perfect
yeah.
remedy for the acne.
Exactly.
Are there any other herbs or the beneficial effects of Neem that you want to
Yeah.
share?
So the herb Neem is very interesting, Swati. So we give antibiotic. So I should not call Neem as an antibiotic, but it has effect. But if you measure the antibiotic effect of a Neem, it is a 1,000 times diluted than any standard antibiotic. So very weak antibiotic. But the beauty of Neem is it does not kill your normal flora.
Because it's a natural.
Exactly. And I have used Neem in such tough cases of acne. And also the MRSA, methicillin-resistant Staph aureus, which is a deadly. These people will go on getting these infections again and again, and every time they get an infection, they will get IV antibiotic. And every month, every other month, and once they come to me, completely stop. After 3 months, they never got MRSA again. So I even published a paper on it, which is published in a medical journal. So the Neem is very, very wonderful. Again, but if you don't clean your diet, the Neem will be this much effective.
Yeah.
Then there's another herb called Manjishta.
Okay.
So this is also in Ayurvedic medicine, we call them Virender, means which actually helps with your skin. So these are given under that classification of herb, which will promote the color of the skin, which will help the cleansing of the skin and help the overall body. Aloe Vera is another very beautiful. You can actually cut the fresh plant and put it on. So a lot of these people, I rather buy a fresh plant, which is $10. Cut small piece of it, use it on your face. You'll see the result. It's so amazing. Even it can be taken internally too. but it's a cathartic, means it can make your bowel movement goes more often. So be a little careful about it. But aloe vera juice is available over the counter.
I know people have westernized all these names and they are selling their products.
Yeah,
But
aloe
just-
vera. There's so many
yeah.
products with aloe vera out
But they
there.
are not. They are just the band-aid on the top of the
Exactly.
something that has happened in the gut. The
Yeah.
result of
Yeah.
that.
And then the probiotic, the missing link. Like in spring season, this is funny. If you look into Mother Nature, what's going on in the Mother Nature? Mother Nature is springing out.
Hmm.
The new
Flowers are
leaves,
coming,
the
buds
new
are
leaves are
coming,
coming.
yeah.
So in Ayurvedic medicine, we said our gut is also, flora is also springing. So if you look at it, our great grandfathers, mothers, they were using fermented food.
Hmm.
The mustard seed ferment. We can also call kimchi, sauerkraut, yogurt in that category. And any vegetable, fresh vegetable, has different probiotic available. So you don't need to substitute. But what we have done, we have given so many antibiotics, we have given so much food which has been sprayed. Your normal flora is not there anymore. So you need to substitute. There is also studies where people were given lactobacillus and bifidus probiotic. Their acne dropped around 35%. So simple solutions, but you can also have, if you're not sensitive to yogurt, A2 yogurt can be a really good solution because it has a lot of acidophilus and bifidus in it too. And you can also make your fermented vegetables out of, like back home, we used to ferment carrots and radishes and
Kanji.
turnips, kanji. You kind of crush the mustard seeds, put in the water, maybe put a little sugar, let it sit for 4 or 5 days, it ferment, you use it. You can also make with the kefir water, coconut kefir water, or kefir water with water plain, but you have to add some sugar because the bacteria needs to ferment, and those kefir buds and starters are available. So if you change it, you start to see your skin starting to be feeling much better.
Gut is something that we all should be taking care of.
Exactly,
What
for
we are-
almost everything. Haven't
Yeah,
been
I
talking
think-
about
yeah,
gut for everything.
Exactly. I was
Everything.
about to come here that any discussion, any topic, any questions that we get from our viewers that you answer here,
Yeah.
the answer is always take care
In your
of
gut.
your gut.
Exactly.
Eat fiber. Eat the food that is available in the
that place,
season.
in that season,
place.
that place.
Yeah. If this hit that chord and you are having the acne, you know where to start from. Disease-free living conversations happen every Wednesday. Thank you.